Our next paper is Democratizing Primary Healthcare with Shift Left Strategy, and the author is Engineer Adnan Siddiquie from EZShifa, Pakistan.
Assalamu alaikum. My name is Adnan Siddiquie, and we are here to disrupt the healthcare system in Pakistan. And one of the reasons I'm here, grateful to Dr. Mona, she kind of nudged me, pushed me, kicked me to be here. What we are doing in Pakistan is we want to transform the healthcare system. Next slide, please. The reason we want to do that is about 150 million people in Pakistan don't have access to healthcare. And about 20 to 25 million people file for bankruptcy each year because of the medical bills. I think you jumped a slide. Can you go back? Go back up. Oh, I have it. In the wrong direction. Okay. All right. So the problem we have in Pakistan is about 150 million people don't have access to healthcare, and about 25 million people file for bankruptcy. When we looked at the whole thing, what we found out, there is no problem as far as the infrastructure is concerned, resources concerned. The only problem that we're finding out is cost of healthcare. And the good and the bad news is the cost of healthcare is artificially inflated, right? And that is causing limited access to healthcare, entry barrier, early diagnosis. One of the examples I constantly use is if I make 25 to 30,000 rupees a month, and if I have to go get my ECG done, and it will cost me 2,000 rupees, and 60% chance it's going to come back clean. My wife is going to make my life miserable for 2 months that I wasted 2,000 rupees, right? Very, very simple. So I have to bring the cost down, but if I can get the ECG done in 100 rupees, then this won't be a problem. So we have a very, very myopic focus. We're going to drive the cost out of healthcare. That's what we want to do. And so EZShifa itself is not a startup in itself. We are developing a whole ecosystem in Pakistan. Right now, the healthcare system is serving about 10, 15 to 20% of the people at the top, and the 50, 60, 70% of the people at the bottom, wo sirf duaon pe zinda hai. And that's the World Bank report, about 150 million people don't have access to healthcare, right? So our goal is to grow from that 12% to 50% in the next 15 to 20 years. As soon as we drive the cost out of healthcare, we want to shift left. Shift left meaning before the disease occurs or before we see the signs and symptoms, that's when we want to tackle it. I was with one of the cardiologists, and she was agreeing, she kind of pushing me hard, if you only deals with the symptoms. And I said, what if I give you a system that will identify the problem 6 months before the symptoms happen? And she said, that's not my charter. Okay, better. All right, sorry. So the problem is we want to shift left. We want to identify as early as possible, and this is not possible unless we use technology. And I think the biggest burden of all this lies in this committee, IEEE. You guys hold the key to the solution. You guys need to step up, take charge, and solve the problem. Not just writing the papers and doing things, which is nothing wrong with that, but let's find applicable solutions. I worked as a senior director of R&D for Hewlett-Packard for 20 years. I was in the States, then Taiwan and China. I managed Amazon Robotics Group. Worked with cutting-edge technology for 20 years. The answer for us, the third world or the developing countries, is not going to come from the cutting edge or the bleeding edge technology. The task or the champions, the leadership, the academia, your responsibility is to find technology which is mature, affordable, and so resources are available, and we come up with a solution that everybody can afford, right? So that's very important for us moving forward. So what we have, okay. Can we go up a little bit? Sorry, do I have the control? Somebody's going backwards. Let me handle it. Okay. So what we have done is we are not taking care of the whole healthcare system. What we decided, we're going to focus on primary care only. And for primary care, what we did was we started with the digital clinic at the top, which is for primary care. Then another big problem in Pakistan is Pakistan is one of the worst countries in the world when it comes to infant mortality and childbirth related complications and deaths. And there is really no serious solution. So we developed a product called Hawa for pregnancy management. Then we have preventive healthcare, easy screening. Then we have an online service. The biggest thing that's going to come out of this is Easy Diags at the bottom left. And that's where most of this group is going to come in handy. We're going to develop biomedical devices, IoTs, integrated systems. When we did all of this, what we found out, we cannot solve healthcare problem unless we focus on mental well-being. So we developed an easy counseling, and now we're also conducting in parallel a study for postpartum syndrome, where females, those who have during pregnancy, go through depression and anxiety. What we are finding out is about 50% of the females during pregnancy need counseling. And there is no screening mechanism, there is no services available. And even if they find out they need help, our survey shows 60% of the females, after they find out, they cannot go tell their husband that they need counseling. 200% guarantee they cannot tell their mother-in-law. So in those circumstances, going someplace to seek help is almost impossible. So what we are saying is, don't worry, just go to your room, take your smartphone with you, hit the button, and have a counselor. And we are getting phenomenal results from those counseling sessions. Okay, that'll be much better, thank you. Okay, can you go up just one more, please? Okay, so this is the digital clinic that we are talking about. This is what we have made. People, those who have, technology is helping people, those who have access to smartphone or internet, which is 20, 25, 30% of the population. 60, 70% of the population don't have access to that. So what we did was we made those digital clinics. We want to place them on almost every street corner. You just walk across and get access to the latest technology and get this clinic. And the good thing is, go to this clinic and you can get all the technology at an affordable cost. You don't need an internet. You can get access to the latest doctors, the greatest doctors, and the whole 9 yards. The second one is the pregnancy for Hawa. In this we have integrated ultrasound. We are getting ready to integrate a hemoglobin test, a non-invasive, plus the iron deficiency test. If you can do 3 of these tests, we can solve 90% of this problem. The good thing is almost anybody can purchase this clinic, start a service, and make a decent living. This is like the Kareem or the Uber model. So we are basically democratizing healthcare. So almost anybody can buy it, provide a service, and make a living. Now we can scale it and sustain it. Another part I want to mention here is a lot of people doing a lot of good work in charity in healthcare. Unfortunately, we're 250 million people, current cost structure, nobody has enough money to solve this problem for 250 million people at this stage. So the only way to solve this problem is to take the challenge, IEEE, drive the cost out of healthcare, and make it affordable for everybody. That's how we will solve this problem. Next slide, please. So there's a point of care, there's a lot of AI going on. What we want to do is we are identifying opportunities, how technology can be adopted. We can develop biomedical devices, IoT engines and all that, integrate that with the AI. We have the data coming out of our ears, so data is not a problem to develop AI modules. And all this can be driven into the product. And at the end of the day, the digital clinic that we have right now, we are doing very basic things: blood pressure, temperature, heart rate, oxygen level, ultrasound, ECG. 5 years from today, I want this to be a complete diagnostic center using technology, developing our own biomedical devices, our own AI engines, our own microscopes and all that stuff, and that's how we'll move forward. Next slide, please. One of the things that we found out is towards preventive healthcare, we are going to schools. In schools, we are measuring screening the eyesight, hearing, color blindness, BMI. UNICEF has a report that about 38% of the kids in Pakistan are at the risk of stunting. So our population, the young generation, 38% of those, 40% of the population is at risk of stunting. And if no intervention is done in 90 days, the defect becomes permanent. So what we are doing is we are identifying them. Once we identify them, we give them micronutrients for 60 days, and the recovery rate is about 80% of those. At an affordable cost, there is no leakage, 100% transparency, and the results are phenomenal. Same application is being used at corporations. We are going to corporations, doing the medical screening upfront, identifying 15 to 20% of the people, those who have some medical issues, proactively managing them. That's driving the insurance cost down, and hopefully that will increase the base from 3% to 10 to 15%, hopefully next in 10 to 15 years. And that's how we will stop those 20 million people filing for bankruptcy. Next step, please. This is the AI, EZDiag. We have first started, our first AI engine is we make from a 15 seconds video, we calculate blood pressure, temperature, heart rate, oxygen level, and blood sugar. We think down the road we can add A1C and cholesterol into this thing. This is our first AI engine. I have a list of about 15 to 20 AI engines that we need to develop in the next 10 years. The good part is, from EZShifa, hopefully next 10 years, we will do 50 startups. We will identify these opportunities, we will hire young people, we will help them build their own startup. 2 years later, we'll push them out, and we will be their first customer. So we want to repeat this process 50 times. So if anybody who is interested in doing anything in healthcare, please feel free to contact me. I'll be more than happy to work with you. Next, please. This is just an app that we have. Almost everybody has it. Next, please. You can access our healthcare system through the mobile phone, the desktop, and whatnot. Next, please. Next slide. So mental health, we talked about this easy counseling. It's not showing the logo here. This is for, I told you about the postpartum syndrome that we are doing. We are also identifying another opportunity. About 6 to 7% of the females that we screen, they are suicidal. So there is an opportunity to identify and prevent those suicides that we are facing right now. And then about 40% of the population right now, which is about 2.5 out of 10 people, is likely to have some mental issues, not mental issues, but can use counseling. We have identified that, and we are working on that to provide that service. Next, please. So developing the technology, this is for the IEEE team here, right? Developing a technology, cutting edge technology, is really no big deal. Anybody, I'm going to use the word loosely, any idiot can get the money and go get the research done and prove themselves that they're ahead of the curve. I was with HP, Amazon, and we have done it. This is not what is the need for the country for us. For us is to identify a technology that's mature, that's available, resources available. When we design something, it should be low cost, it should be simple to use, and there is no consumable. That should be the criteria to develop almost any product down the road. Easy to use is because we have about 50 million kids in Pakistan, those who should be going to school. Unfortunately, the government number is about 17 million are in school. 33 million are not in school. 10 years from today, they will be in the job market with no education, no skill. If I want them to utilize something, we have to design something which requires little or no skill to operate it. And you guys have to pick up the challenge. And so when you come up with products, make sure it's simple to use, no consumable, so you can keep the cost down, technology that's mature. Next, please. So how do we completely solve the problem? What we are thinking about it is, I want to have 20 to 25 digital clinics in a certain area. In the middle of that, I want to have an ER. And a cluster of the clinics and the ERs, 20 of that, there should be a full service hospital in the middle. What we want to do is the money that's, and this is, I'm saying from my side, I'm not representing EZShifa when I'm making this statement, this is my personal wish. The money that we are getting from digital clinics, we should run a subsidized ER. When a boy or a young man takes his father to the hospital for heart attack, I don't want him to be worrying about the bill. I want him to be focusing on his father to save him, right? So the ER should be subsidized. And the money that we are getting from all this, the full service hospital should be free of cost. The utilization of full service hospital is about 1.5% to 2%. Right now it's about 2.5% to 3% because there is no primary healthcare system available. Once we build the primary healthcare system, that's going to drop down to 1.5% to maybe 2%. In any civilized world, 95, 96% of the people should be able to take care of 2% of the population. I don't think it's a no-brainer. So by 2035, 36, we hope to accomplish that goal, and that's when I go back to my retirement and start playing golf again. Next question, please. Next slide. So we are a US-based company. I'm based out of Seattle. We have presence in UK, Nigeria, Saudi Arabia, UAE. We have active conversations going on in South Africa, Rwanda, and Sierra Leone. Next, please. So there's a lot of myths going on. Telehealth mein, if the doctor doesn't touch you, then we will not be able to solve the problem. There's total myth. There is no data to support that statement. Ab jab bhi main telehealth ki baat karta hu, somebody will come up to me कि वो तो जब तक डॉक्टर हाथ नहीं लगाएगा कुछ नहीं होगा. There is no data to support that. I'm a certified black belt. मेरी दुनिया में हर चीज जो Excel spreadsheet पे होती है. And I have not seen a single patient call me and said कि डॉक्टर ने हाथ नहीं लगाया. So we have all our data for the last 5-6 years. Our approval rating from the patients is about 96-97%. People like it, so there is no. Next slide, please. This is our growth chart. It's linear. It is not wo hockey jo startup wala hockey stick wala jo hai. We have not found the sand beach landing yet. We are working in several verticals. I'm very optimistic about 26, 27. Hopefully we will hit that and we'll be on our way. Next slide, please. This is our team, and I really appreciate the time. Thank you very much for the opportunity, and let's solve this problem. The nation is waiting for us. Thank you.
अदनान सिद्दीकी साहब से मेरा सवाल प्लस कमेंट प्लस क्वेरी है अगर वो
Adnan Siddiquie साहब, please can you come forward? Thank you. Mic दे दें इनको.
स्टेज पे आ
जी.
अच्छा सर, फर्स्ट ऑफ ऑल मेरा नाम मुनीस सिद्दीकी है और IEEEP का वाइस चेयरमैन हूँ मैं कराची सेंटर का, और हेल्थ केयर के शोबे से भी थोड़ी सी वाबस्तगी. आपकी बहुत अच्छी प्रेजेंटेशन थी.
थैंक यू.
उसके अंदर देखें दो चीज़ें इंपॉर्टेंट हैं. एक तो आपने जो चीज़ें बताई उसमें एक कोऑर्डिनेशन, इंटीग्रेशन और AI वाला एलिमेंट है. एंड आई एम श्योर उसके पीछे बैक एंड पे किसी ना किस्म की कोई हार्डवेयर कंपोनेंट्स, कुछ हार्डवायर चीज़ें भी होंगी. तो फॉर्चुनेटली और अनफॉर्चुनेटली पाकिस्तान में जब भी आप हेल्थ केयर सेगमेंट में कोई भी हार्डवेयर डिवाइस या कंपोनेंट यूज़ करते हैं तो उसकी रेगुलेटरी रिक्वायरमेंट बहुत ज़्यादा स्ट्रिंजेंट है. उसको FDA अप्रूव होना, CE अप्रूव होना, या जो ड्रग रेगुलेटरी एक्ट है उसके अगेंस्ट ड्रैप से उसकी रजिस्ट्रेशन बहुत ज़रूरी है. अदरवाइज़ आप कितनी ही अच्छी चीज़ बना लें उसको इम्प्लीमेंट नहीं कर सकेंगे. तो वो मैं थोड़ा सा समझना चाह रहा हूँ कि क्या उसके ऊपर आपने कुछ काम किया है या नहीं. प्लस आपने कहा कि कुछ ग्लोबली 5-6 कंट्रीज़ में ऑलरेडी आपकी प्रोडक्ट है, तो क्या वहाँ जो आपकी प्रोडक्ट्स चल रही हैं वो कोई FDA या CE अप्रूव्ड या रजिस्टर्ड है या नहीं?
So if you deep dive into this, what we have done is we took a box, and in that box we start putting the gauges, BP meter, accelerometer, thermometer, and all these devices. The devices that we are picking are certified in that country. तो पाकिस्तान में जो हम devices इस्तेमाल कर रहे हैं, these are imported devices with the Chinese mark, CE marking, and some of them have the FDA marking. So as such, if you think about this, we are not doing anything. We are just taking the device and using the communication part. I totally agree with you कि as we develop these products in-house, हमारा अपना गोल ये है कि जितनी भी products हैं, we're going to manufacture those in Pakistan. Give you an example. I'm not a cheap person. I don't mind writing checks. Ultrasound की जो probe हमें मिलती है वो $2,000 की मिलती है. And I hate writing that check. I'm a hardware guy. I look at this thing and I'm looking at this thing saying it's not more than $100. Why the hell am I paying $2,000 for this? This is across all medical industry. So we're going to develop all of these devices in Pakistan. DRAP, we can argue that DRAP is helping or hurting Pakistan. I'll park that debate. I'm from USA. I'm a US citizen. मुझे ज़्यादा मसला होगा. I'm going to get the FDA approval for the devices that we are making, and then we'll bring it here. उसपे stamp लगवा के we'll submit that. Not a problem.
जी
Oh, sorry. Sorry. Okay.
It's all right.
Yes, sir. Alhamdulillah.
My name is Shahnaz Tabassum. I'm from Meridian University और मैं वहाँ असिस्टेंट प्रोफेसर हूँ और 25 प्लस ईयर्स हो गए मुझे वहाँ टीच करते हुए, लेकिन मैं टीचर ही रह गई, मैं इंडस्ट्री से मेरा रहा ना कुछ. लेकिन मैं आपको एक बात बताना चाहूँगी और पूछना भी चाहूँगी कि आप भी ये पूरा सेटअप बना रहे हैं जिसमें आपने ये डेटा की बात की है,
हम भी सुनना चाहते हैं वो क्या कह रहे हैं.
तो मैं इसीलिए पूछा है आपने रियल टाइम डेटा यूज़ किया है सर?
Yes.
तो ये डेटा आपने वैसे कर लिए?
नहीं. We have about 300 clinics in Pakistan, and I'm collecting data, almost 30-40 patients a day from all of this.
आप क्या मतलब हमारी यूनिवर्सिटी से अगर कोई आपको कोई एड मिल सकती है तो क्या मिल सकती है?
So the first aid that you guys gave me, I'm a proud NED graduate.
जी
I graduated from NED in 1984.
94 graduate?
Yes, before some of...
94 graduate means it's 84.
Sorry,
10 years.
nine-
10 years of course lag. मैं 94 की graduate हूँ.
अच्छा.
जी सर.
So I think there is जो एक हमको gap लग रहा है, almost every academia, every university has an ORIC program.
Yes, sir.
And I see a huge gap between them and the industry. The papers that are being published, not being condescending, my apologies if I hurt anybody, the quality of papers are horrible. We need to bring some practicality, bridge the gap between the industry and the academia.
क्वालिटी पेपर फ्रॉम यूनिवर्सिटीज.
जो हमारी स्ट्रीम है उसमें बायो स्ट्रीम अलग है हमारी और मेडिकल स्ट्रीम अलग है. उनमें से अगर आपको स्टूडेंट के लेवल पे कुछ ऐसे लोग चाहिए जो आपसे हम इंटर्नशिप भी करें और आपका वर्क विदाउट एनी कॉस्ट करते थे, डेटा वगैरह जो भी उनको डायरेक्शन करें.
Sure, definitely.
हम लोग कर सकते हैं.
Definitely.
इसके लिए अगर आप चाहें
Yes.
हमारा वेबसाइट है NEDUET का, डायरेक्ट आप बायोमेडिकल जो डिपार्टमेंट है वहाँ पे कॉन्टैक्ट करें.
आप लोग, I guess you guys can also continue, afterwards. Irfan Saab, you have a question, I think? Yes,
जी.
please. Thank you so much.
Madam, thank you very much, and I'll be in touch with you.
जी my name is Irfan Ahmed. I've been hearing for quite some time that there are gadgets by which you can have blood sugar tested prick free.
Yeah.
I've not seen them as yet, but on social
I
media,
can show you one.
You have developed some like that, like
Yeah.
oximeter. You just clip it on, and oh, that's great.
Yeah, yeah.
Thank you.
So actually, I have a list of about 50 AI projects that I need to develop in next 10 years, all related to, and I'm not coming up with these things. The data is telling me that this is a need, we need to fulfill that need. And we are working on those parts.
All right. Thank you.
Okay, thank you very much. Please. Yes, please.
My name is Shahid Aslam. I am the Honorary Secretary of IEEEP. During your presentation, you said more than once that IEEEP should highlight or should take it up. What specifically do you look at, expect from IEEEP in this project? And number one, my second question is, are you focused on the villages or the interior or in the big cities? Is your project more focused on the interior or in the big cities, urban areas?
So the healthcare की problem जो है ना, it's equally divided between urban and rural areas. Rural areas में access की problem है.
नहीं, excuse me. Rural areas में access problem है और access की और medical facilities की need बहुत ज़्यादा है. My daughter is working in, she has an NGO, Save Delivery, Save Mother, and she is working in rural Punjab and to educate women and all these issues. So I think वहाँ पे ज़्यादा ज़रूरत है. What is your opinion? What is your experience? Maybe it might not be so lucrative, and as compared to these urban areas.
I think the need is both. रूरल एरिया में एक्सेस की प्रॉब्लम है, जो अर्बन एरियाज़ हैं वहाँ पर प्रॉब्लम ये है कि अफोर्डेबिलिटी की प्रॉब्लम है. हमारा जो ड्राइवर है, he and his family, they know where the doctor is, but they don't have $10,000 rupees to pay them, right? So
But sir, आपकी प्रेजेंटेशन में एक चीज़ एक लफ्ज़ मैंने नहीं सुना, तो प्लीज़ क्लैरिफाई टू मी कि गवर्नमेंट के साथ इंटरेक्शन, गवर्नमेंट सपोर्ट या कोई लेजॉन या गवर्नमेंट अप्रूवल, गवर्नमेंट का कुछ भी नहीं है आपके साथ इन्वॉल्वमेंट.
if I answer this,
No.
क्या हमारे एक वो कहते हैं कि अगर if you don't want to impede yourself, you plead fifth. I will not answer this question, it may harm me.
Because sir, in Pakistan, all these multinational donors, they are paying a lot of heavy sums for different diseases, especially in the rural areas. I know for a fact my daughter works, but the government is impeding all of those projects.
I'll be more than happy to. I'll be more than happy to come to your office.
You have reserved your commitment. मैं तो बता रहा हूँ ना क्या मसाइल आते हैं.
जी जी.
कुछ चीजें which I cannot share in this on this mic.
So, why don't I'll come and stop by your office and say hi and say have a cup of tea with you and we can explore the possibilities. IEEE का आप कह रहे थे.
आप IEEE से क्या expect करते हैं हमें बताएं.
हाँ.
आपने दो दफा कहा IEEE.
This part, I'm concerned. Pakistan is the third largest importer of oximeters, thermometers, BP meters. 250 million people. I'm a hardware guy and I'm going, what the hell? Why we are not making those devices in Pakistan? I mean, it's very, very simple. One of the examples that I'm using is, हमारे एक weight scale है. I pay 4,000 to 5,000 rupees for that weight scale. हमारे उस पे स्क्रीन के सामने बैठने के लिए हमने एक स्टूल बनाया हुआ है. उसके स्टूल के उसको पोस्ट को लेके I put the strain gauges in there and I cut the weight. So I dropped the cost of 4,000 rupees to 600 rupees. So these are simple things and I'm expecting the electrical engineers, academia and all these to come up with these services, these small devices. BP, oximeter, thermometer, everybody has it. Why are we using 3 displays, 3 CPUs, 3 power supplies and all that? Combine that into one, drop the cost into 1/3 and make it affordable to everybody.
I guess let's wrap it up because we are short of time. This will continue and I hope that this discussion keeps on happening over